Related research. Sullivan's theory rests on the assumption that unhealthy personality development results from interpersonal conflicts and difficulties. Prior to pre-adolescence, children often internalize a parent's negative perceptions of them, which may lead to some form of emotional disturbance. Sullivan reasoned that if interpersonal relationships can be the cause of emotional disturbance, then they can also be the cure. In this section, we review some of the research on two quite different types of interpersonal relationships: imaginary playmates and patient-therapist interactions. Imaginary playmates. More than any other personality theorist, Sullivan recognized the importance of having an imaginary friend, especially during the childhood stage. He believed that these friendships can facilitate independence from parents and help children build real relationships. In support of Sullivan's notion, some evidence exists that children who develop imaginary friends, in contrast to those who do not, are more creative, imaginary, intelligent, friendly, and sociable. Paula Bolden and Chris Pratt reported some interesting data on 3 to 9-year-old children with imaginary playmates. This study found few differences between boys and girls in frequency of reporting an imaginary friend. Also, parental attitudes toward their child's imaginary playmate were quite positive. Only 1% of parents thought the imaginary friend was harmful for the child, whereas 2/3 of the parents believed that having an imaginary friend was beneficial. Bolden and Pratt also found that nearly 80% of the children were happy or in high spirits while playing with their imaginary companion, only 3% were lonely and another 3% angry. 1/4 of the children needed a chair placed at the dinner table for their imaginary friend, 1/3 needed extra room in the bed, and more than 1/3 needed extra space in the car. Another study by Bolden and Pratt examined the question of whether children who develop imaginary friends have difficulty distinguishing fantasy from reality. One possibility is that children who develop such non-existent friends simply are more imaginative in general, with greater dispositions toward daydreaming and fantasizing. A second possibility is that children with imaginary companions are more credulous. That is, they are more likely to believe in fantastic and magical images, but behaviorally, they are no more likely to be afraid of ambiguous visual imagery than children who do not believe in imaginary friends. The procedure used by Bolden and Pratt called for an experimenter to bring each child into a testing room that had various toys and a play tent. After establishing rapport with the child, the experimenter asked the child to retrieve a writing pad from inside the tent. Then she described a children's story she was writing about a monster who lives in a cave, much like the tent. The child was then told that the monster was very good at hiding and that the experimenter could not see it. Therefore, she asked the child, "Do you think you could help me describe the monster?" After the child described a monster, the experimenter thanked the child and told him or her that the monster you described for my story would fit in a cave the same size as the tent. At this point, while the child's attention was focused on the tent, a monster-like silhouette was projected on the side of the tent for no more than 3 seconds. After ensuring that the child had seen the image, the experimenter asked the child whether he or she would put the writing pad back in the tent. After a brief free play period with the toys in the room, and as the child was being escorted back to the classroom, she or he was asked simply, "Do you have a make-believe friend whom you talk to and who goes places with you?" Next, 2 raters, blind to the purpose of the study, coded both verbal and nonverbal videotaped responses. In the verbal category, children either said they saw a monster or did not, whereas in the nonverbal category the child either moved or jumped at the image or did not. Other verbal behaviors that were coded included spontaneous comments concerning a monster during the free play period. Other nonverbal behaviors included whether the child approached the tent when asked to put the pad back in it. Compared with children who did not have imaginary companions, those who did were significantly more likely to report having seen a monster and to have moved or jumped upon seeing the silhouette. When asked whether they thought a monster might have been in the tent, the group with an imaginary playmate was much more likely to say yes, 42% versus 5%. In addition, the imaginary companion group was more likely to experience daydreams, to realistically visualize people in their minds, and to sometimes get real scared because of something you think about. Bolden and Pratt argued that these results demonstrate a host of imaginative and emotional differences between children who do and do not have imaginary companions. It is worth noting that from the same dataset, Bolden, Babin, and Pratt studied the linguistic development of the two groups and found that the imaginary playmate group used more mature language relative to the other children. The researchers argued that this demonstrated enhanced social cognitive skills in the imaginary companion group, further providing evidence for the Sullivanian view that having imaginary friends enhances rather than thwarts social, cognitive, and emotional development. In summary, research tends to support Sullivan's assumptions that having an imaginary playmate is a normal, healthy experience. It is neither a sign of pathology nor a result of feelings of loneliness and alienation from other children. Indeed, preschool and school-age children with an imaginary friend tend to be more creative, imaginative, intelligent, and sociable than children who do not have an imaginary companion. Therapist-patient relationships. Sullivan was the first personality theorist to recognize the potential therapeutic value of the relationship between therapist and patient. He and his followers have argued that what the therapist says and does may play an important role in the patient's well-being and progress, and that the purpose of therapy is to create a new relationship in which the patient internalizes positive rather than negative aspects of the therapist. Patient relationship. Hans Strupp, William Henry, and colleagues have used Lorna Smith Benjamin's structural analysis of social behavior to see how interpersonal dynamics between patient and therapist affect the success of therapy. The SASB looks at interpersonal behavior from three perspectives: 1. Focus on the other, or a person's typical behavior while relating to another person; 2. Focus on the self, or a person's typical reactions to another person's behavior; and 3. Introjection, or turning inward and reflecting on how one has been treated by significant others. The SASB allows researchers to study interpersonal relations moment by moment and to see what the therapist actually does to foster or impede therapeutic progress. In an early study, William Henry, Thomas Schacht, and Hans Strupp used the SASB to hypothesize that patients would develop views of themselves that were consistent with how the therapist viewed them. In general, Henry found that patients developed relatively stable behaviors that were consistent with the way their therapist treated them. More specifically, these researchers found that therapists' hostile and controlling statements were highly correlated with patients' self-derogatory statements. Also, patients whose therapists belittled, blamed, ignored, or neglected them tended to blame themselves and to show poor therapeutic outcome. Later, Strupp, Henry, and their associates used the SASB to demonstrate the positive effect of therapists' behavior on patients' self-perceptions and on their therapeutic outcome. When therapists in this study used affirming, helping, and nurturing techniques, patients tended to be more disclosing, expressive, and trusting, as well as more self-accepting and self-nourishing. Further, by internalizing the more positive aspects of the relationship, patients showed less depression and anxiety and greater overall improvement in psychosocial functioning. Later, Russell Hilliard, William Henry, and Hans Strupp examined the early developmental history of both the therapist and the patient to study therapeutic processes and outcomes. This study, which was part of the Vanderbilt Psychotherapy Research Project, examined the effects of therapists' training on the effectiveness of time-limited dynamic psychotherapy. Patients were adults, mostly European Americans, responding to notices in the media requesting volunteers. Therapists were 8 licensed, experienced, psychodynamic-oriented clinical psychologists and 8 psychiatrists in private practice. As hypothesized, Hilliard found that early childhood experiences of patients and therapists contributed to therapeutic outcome. More interestingly, however, was the finding that therapists' developmental history was a more powerful contributor to outcome than was their expensive and extensive training. The implications of this finding are monumental. Graduate schools and other institutions that train psychotherapists could do a more effective job of selecting applicants if they considered those applicants' developmental history. This finishing may also be linked to Sullivan's childhood experience with a schizophrenic mother and his later phenomenal ability to successfully treat schizophrenic patients. Nevertheless, developmental history alone was not sufficient to account for all the links Hilliard found between the process of therapy and therapeutic outcomes. These authors suggested that a combination of therapists' and patients' interpersonal histories and current interpersonal relationships may offer the most reliable predictor of therapy outcomes. Most recently, a study by Kelly Schlered and Julia Hyman used the SASB to investigate the relationship between sexual abuse as a child, self-concept, and adult sexual behavior and satisfaction. They hypothesized that a victim of childhood sexual abuse has the problem of reconciling her abuse with her sense of sexuality and integrating what the experience taught her about how others treat her body. Schlered and Hyman divided their participants into 3 groups: those who had experienced childhood sexual abuse only, CA, those who had experienced both sexual and physical abuse, SPOT, and those who had experienced no abuse, NA. Based on the Sullivanian notion of introjection, they predicted that women who experienced both sexual and physical abuse, compared with those in each of the other 2 groups, would be highest in sexual dysfunction, sexual risk-taking, and viewing their sexuality hostilely than the CSA and NA groups. On these dimensions, the CSA group was predicted to be in middle between the SPA and NA groups. Participants in the study were 148 women recruited from the community. All completed a modified version of the SASB that asked them to rate their sexuality for 2 different contexts, once at its best and once at its worst. Second, they rated their sexual functioning over the past year by answering questions concerning number of partners, contraception use, safe sex practices as well as masturbation, sexual arousal, frequency of orgasm, and pain. Finally, participants completed general measures of depression and anxiety. Because abuse victims were higher on depression and anxiety than the non-abuse group, these 2 variables were held constant in the analyses. Results supported the basic predictions. The sexual physical abuse group was highest on negative affect, fear, anger, and disgust, during sexual arousal, with the sexual abuse group being next, and the non-abuse group being lowest in negative feelings. When reporting sexuality at its worst, the 2 abuse groups reported less friendliness and more hostility in their sexual experiences. Sexual risk-taking also distinguished the groups, mostly on the number of sexual partners, with abuse groups reporting an average of 21 lifetime partners and the non-abuse groups reporting an average of 8. However, Schlered and Hyman found no differences between the 3 groups on general sexual interest, sexual arousal, or sexual fear. This empirical approach is similar to Sullivan's theoretical notions that adult self-concept is at least in part formed by childhood sexual abuse.